All right, so we're a little out of focus, right? Well, let's see if we can make it better. Here's 1 or 2. Much better. So today I want to talk about the differences between online exams and in-person exams from a doctor's point of view. So we can do almost anything nowadays online. It's fast, simple, and sometimes it's cheaper. Also, we're able to do this all from the comfort of our own homes. No stranger danger, awkward situations. We don't have to rely on other people's knowledge because we can just learn about it on YouTube or Google. Now, when it comes to our health, even Google can steer us in the wrong direction. So I had my wife take one of the online refraction exams, and I watched in the background and took some notes on what I considered some potential problems that could cause you to receive maybe a not so perfect prescription. So number 1, the brightness of your screen could be an issue. If it's too dim, that'll cause a decrease in contrast, which could make it harder for you to see the letters. Number 2, the distance that you're supposed to be from the screen. To determine what distance you should be from the screen, they ask for your shoe size. Now, I would never try to buy a pair of shoes for my wife. She can wear like 3 different shoe sizes depending on the brand. So using the shoe size may not be very accurate. I also noticed my wife's steps were slightly shorter than they should have been because she didn't quite line up the tip of her toe to the back of her heel. Now, I never knew my wife's handicap in this seemingly simple task. Number 3, the test used is what I consider a vision screener, not a refraction. This is called tumbling ease. This is seen at school screenings, a physical that you might get from a pediatrician or a general family doctor. Number 4 is how much are you straining to see that small letter. Squinting, we're not supposed to do this, even though it's natural. And maybe we're leaning forward to see the tiny letters or possibly sliding back and not even knowing it. It might make it look like you can't see those letters even though you should have been able to see it. So 5, if you have a current prescription, they may just copy over that power, even if you feel like it's not good enough. Yes, they do offer refunds if you're not happy with your new prescription, but now you just wasted all that time that you were trying to save by doing this at home in the first place. So next I'm going to talk about in-person eye exams. So as an optometrist, I'm trained to help you get the best vision that your eyes can give you. Now it's my job to figure out if glasses are necessary or not. So some examples are I might have a patient come in, say, I'm not able to see road signs. On my way home at the end of the day, what should I do? Do I need glasses or not? So glasses could very well be the solution that we're looking for, or updating that existing pair. But it could also be as simple as showing you how to give your eyes a little TLC. So other things that can cause this are simple things like dry eyes, computer eye strain, maybe even contact lens overwear. So I'm not going to talk about those today, even though they would be great topics for another video, but it would take way too long to explain each one of those and how to fix it. So number 2, a child failed the screener at school. The parents are trying to figure out why can't they see that sign. They never complained before. Well, number 1, kids don't always complain about blur because they think everybody sees this way. So yes, a pair of glasses might be perfect for them. Or maybe there was a problem with the test. Just like we saw on the online exam, if we were too far back, seeing those tiny little letters were almost impossible. So that could have happened during the test. Maybe the child was tired. They couldn't sleep last night. Maybe they were playing video games or cramming for a test. Don't know, but the eyes were too tired to see as good as it could have. Or also we'll see maybe a child was lying. I know we never want to think of a child lying, but it happens. They see their best friend just got glasses. They think it would be really cool to get glasses too. Maybe not to see better, but to look better. Number 3, what if we have a hard time reading up close? Now this isn't just for the older people having difficulty seeing up close, holding it further away, but it's also sometimes for kids. We're spending more and more time in front of a screen, so after a while those eyes get tired. So yes, reading glasses might be great just to relax the eyes, or maybe getting some over-the-counter readers or cheaters. Also, that dry eye thing that we talked about before, it could be another issue there. Maybe an extended time sitting in front of a screen or reading a book, that can also cause the eyes to tire, and maybe just it's a lack of light. So what else are you going to get from seeing an eye doctor? Well, of course we're going to check your vision, but not just your center, but also your peripheral vision. We love it when you see 20/20, but more importantly, we want to make sure everything is healthy also. So vision, but also muscles. We're going to test the muscles of the eyes, the movement, left, right, up, down, all the above. Also the nerve test. How are those nerves doing? We have over 1 million nerves in each eye that gives us that vision, but also lets our eyes move around, the pupils to work, all the above. Oh, we also want to check the pressures. If that pressure is too high, you would never know unless it's extremely high. But if it's just a little high, sometimes it can cause nerve damage and not even know it. So not just the front of the eyes that we're going to check, but also the back of the eyes, all the above. So by doing this, we're able to find many problems that can not just save your vision, but also your life. There are many eye conditions that can cause vision loss before you even realize any change is happening, such as glaucoma, retinal tears or holes, diabetes, high blood pressure, high cholesterol, tumors, aneurysms, cancer, and so much more. So like the old saying goes, the eyes are the windows to the soul. The eye can show so many things with the whole body. It's like a red flag for the body. It's our job to watch for it, and when we see it, we get you the help that you need before it gets worse. Okay, so enough scary stories. My goal is not to scare you, but to inform you. So what if it's determined that you actually need glasses or you need an update in your prescription? So now you have a chance to try on and look at as many different frames, styles, colors as you like, and you get to work with a highly trained technician or optician that will help make sure those glasses are exactly the fit that you need and that you're not going to go home and regret what you got. They will also take measurements of the frames on you to ensure that you get the most out of your new glasses. Now, if your glasses are not measured correctly, you will feel off balanced. You might feel like you're walking up a hill or down a hill. You'll get headaches. You might feel like your eyes are crossing or pulling, or it just might be blurry. So that's about it for this video. So I just want to remind you, most of us eye doctors, we chose this profession because we love the idea of creating a better life for people like you by giving you the best vision possible. So to the small, seemingly insignificant moments of our life, like being able to see the blades of grass or leaves on a tree, to the extreme highs and lows that mold us into the people that we are today, that is our true focus. So before you decide to find a quick solution to renew your glasses or contact lens prescription, remember we'll be here ready to see you with the most updated information and technology to help you see and feel your best. Now, if you thought this video was useful and informative, then please give it a like. If you have any questions, then leave a comment down below and I may answer it in a video just like this one. Now here's a question for you. What is one of your earliest memories that you had when you got your first pair of glasses or contacts? So always remember, find your true focus, hold on to it, never lose it, and I will see you next time. Bye. Hide. Hide. Lily, there you are. Okay, go. Go.
Hide.